to have an open, frank discussion in this country about the injuries that we're seeing in our healthcare system, in not only kids, but NHL players themselves. Serious injuries. We're talking spinal cord injuries, concussions. If you look at 7 consecutive seasons, 97 to 2004 in the NHL, there was over 500 concussions. And so I don't think Canadians enjoy missing Crosby playing because of concussion.
Some staggering numbers there from the Canadian Medical Association talking about concussions in the NHL. We are now going to speak about concussions on a local level. We're joined now by Dr. Roger Zemek here at the Superdome. Dr. Zemek is an ER doctor at CHEO. You're also leading a Canada-wide pediatric study on concussions in which CHEO is involved as well. Yes. I want to get to the basics, and I want to start right from what is a concussion for someone who doesn't actually even know, and I think that's a pretty good vast majority of the population.
Well, concussion is an injury to the brain that occurs by some sort of blow. That blow could occur to the head, it could actually occur to the neck, or even to the body, such as in a body check, in which the head shakes inside and causes the brain to have an injury. And that injury causes some sort of disturbance to how the brain works, resulting in a collection of symptoms. Finally, the last thing to make a definition of concussion is that concussions don't show up on our routine pictures. So sometimes when we have people come to the emergency room to get things like a CAT scan or even an MRI, in a concussion, those are normal, which makes it even more challenging sometimes to make that diagnosis.
Yeah, that must pose some big challenges to be able to say you've had a concussion. So how do you make that diagnosis?
So the diagnosis is one based on the presentations of symptoms on the history and the physical exam. So patients can have a constellation of symptoms. They could have problems regarding their thinking, so for example their concentration, their memory, what they remember. They can have problems regarding their physical symptoms, so sometimes feeling nauseous, even vomiting, having problems with their vision or their hearing. They can have emotional or behavioral changes, so they could be acting more sad or more irritable. Maybe they could be laughing, interestingly enough, inappropriately.
Do those symptoms come on immediately? We're on a field. If a kid right here took a hit and fell to the ground, would they experience that right away, or could it be delayed a couple days or hours?
It can be delayed. Often children will have some symptoms that they present with. Interestingly enough, different symptoms may evolve with time. Sometimes when the brain starts thinking or the body starts exercising again, the blood flow increases to the brain, and that can exacerbate symptoms as well.
So going back to a sport too soon after a concussion can bring up those symptoms again?
Exactly. And that's why there's the big change in when in doubt, sit them out.
Right.
So if you're not sure if they've had a concussion, the safest thing to do is to rest. There's also recommendations based on lots of experts on the way to return to play in a graduated fashion, meaning you take it one step at a time before increasing your activity.
Is there one general rule, or is every case different?
Every case is different, which is a change. When I started my training, there was rough rules based on how long their initial symptoms had presented and whether patients lost consciousness. We now know you don't need to even lose consciousness to have concussion.
That's right.
So those guidelines and recommendations have evolved as we've learned more about what constitutes a concussion, as well as the fact that every person's different. And whereas one person may not have lost consciousness, they may need more time even to recover than someone who did.
Now, as an ER doctor at CHEO, you see concussions coming into the emergency room. We have those numbers from CHEO, and we're going to take a look at those numbers right now. Over the past year, you have seen 400 total visits to CHEO emergency room from April 2012 to March 2013 related to sports. 400 in 1 year.
Yes.
That's astounding.
It is astounding, and even more astounding as well. I know there's 400 to sports. There's hundreds more that are not sports.
Wow. Let's look at those numbers. We're seeing the most of them in hockey. Over 100 in hockey, and then 58 and other winter sports, and then rugby and football come in at about 53.
So this reflects, I think, a lot of the passion for sports we have in Ottawa and our young youth, especially with Canada's strong historical tradition of hockey.
Of course.
Interestingly enough, when you look across Canada and across the United States as well, soccer's proportionally higher.
Right.
So sometimes it's broken down by boy and girl, but concussions can happen on any sport. Obviously, the contact ones are at higher risk.
Of course. Let's take a closer look now at another board here with regards to hockey. And and how those hits, those concussions are coming in. 64 struck by another person, 45 struck by other objects, 7 struck by the puck, and 6 struck by a hockey stick. That's 64. So the majority of them struck by another person. So that's in a body check or some sort of contact between player and player.
It could be collision of any sign.
Yeah.
And that's one of the things that's so important to realize, that concussion, you don't even have to hit the head. Again, a body-to-body blow can cause concussion, which ties into the fact that there will never be a truly concussion-proof helmet.
Right.
In the sense that even if your head is fully protected, if your body collides with another body and you're going at a fast enough speed, the brain inside your skull can still shake and cause that concussion.
Dr. Zemek, very useful and very good information. Thank you.